everybody for being here today. We're very excited that you're joining us today, and we are members from SG2. Let's see here. And our topic and solutions group 2, it's initiating and sustaining parent and patient support groups. I want to remind everybody that the interpretation is available for Spanish and French. If you at the bottom of your Zoom screen, you can then choose interpretation and select the language. Hay interpretación en español disponible, lo seleccionan la interpretación y escogen el idioma español. And also, we have the chat feature, so anytime during the presentation, if you have a comment or a question, you can type it in and we'll mention it and bring it up later. So I want to introduce our members of this group. We have Diana Borges, Dr. Diana Borges and Garrett Davis, Christian and myself from who was a scribe, and myself from TF. I'm a program manager. And our team members are Zainal Ahmad, Dr. Marina Camponico, Dr. Daisy Macis, Javiera Cornejo, Helena Kulis, Dr. Felicity Mehendale, Linus Lee, Dr. Suraj, Kim Robertson Smith, and Francisca Salazar. And now Gareth and Diana will lead us in the presentation.
Okay, it's great to have you all here. So pleased to have the opportunity. And we really enjoyed the first session, and there are some overlaps, which is no surprise really. And I think we will all get a lot from combining the outputs of all three separate roundtable discussions today. So our group basically is a mix of different health specialists, and not surprisingly, the biggest group we have in our mix is NGO leaders, of course, of which I am one. And we have a good country representation from around the world. And we know this from doing link-ups by Zoom, where there's been sometimes 14 hours between one person and the next. So it's been complex, but it's been very, very useful. So next slide, please. Okay, so a bit of background. Patient support groups. What do we mean by parent and patient support groups? We had a lot of discussion about this theme, and it was apparent when we did one of the surveys that not everyone was particularly clear what a parent and patient support group is. I think the key aspects for us, we agreed, was that there needs to be some element of parents working with other parents, or families working with families, or individuals working with individuals, providing emotional support, all kinds of support. The actual facilitation of the support group could come from a member of the cleft team or member of the community. So that wasn't so important. There was the key thing we felt was it needed to be some key element would be the parents and individuals supporting each other through empathy. So I think that's what we mean. And we've had all sorts of phrases. We've had peer support groups, cleft support groups, parent and patient support groups. But I think if we stick to parent and patient, we all know what we mean. And we had a long discussion about why is this so important for low and middle income countries. We have support groups in high income countries, but why is it especially important in low to middle income countries? And we actually know from our own work that cleft support groups can provide an extra resource for the teams. And I know I've got some on the network today who are from Bulgaria, where I've done a lot of work, certainly going back 10, 15 years. And I think there is an element where patient support groups add a huge added value, and actually a unique essential value, and can provide support in a structured way to a cleft team that may have just one or two team members. And they can provide all sorts of support through community awareness as well, making sure that cleft care is resourced better, So I think that there's a very strong case for actually emphasizing the important role that support groups can play where resources are hard. So I don't see managing a support group as being something that goes against resources, it rather increases resources. And the last question here is around research and research focus, which is hopefully what we're going to arrive at the end of today. So I won't dwell on that. Next slide, please. So the methodology, I was watching the first presentations where there was a lot of emphasis on literature reviews and articles. I suddenly thought, oh, what about us? But I do remember at the start of our process, we did quite an extensive research and found there was very, very little on in the established journals about support groups and their value, specifically in cleft care. So when we were putting together our foundation materials, it was mostly around the knowledge of people in our group. It was about the experience that I have had over the years working in the UK and internationally. And we couldn't really find any resources. During the surveys, it turned out there are some very limited articles. I think there's some from the UK now about the added value of cleft support groups, but generally it's not an area that's being well covered. So the foundation materials, it's really, we use the material from Clapper about how parents can support other parents. There was a presentation about patient-centered care, which goes hand in hand with our first session today. And the various roles from working in various parts of the world, the various roles that patient support groups can have. So that was it was actually a good starting point, even though there was nothing in the literature of significance. Our discussions at the 4 meetings were frank, and we had concerns. We put down some phrases here about safe place, whatever we do, whatever we recommend, patient safety is at the core. There's no money available, there's no resources. What we have with the support group is unique. Again, this word unique came up time and time again. There's actually something that can't replace the empathy that someone who's traveled the same journey can provide. We then looked at surveys, and we thought we need to survey patient groups, we need to survey healthcare professionals. And these, as we will all know, were put together quite quickly. And I think if we had more time, we would have maybe chosen the wording slightly differently, but we might still have got the same results. We got a huge number of people responding, which we were amazed at. We had 182 responses from support groups and parents and 190 from healthcare professionals. So I'm really amazed that we got such a strong response. And then we obviously sat down and analyzed the surveys and tried to find out what people were saying and what was happening and how they could actually address our means of putting together some recommendations. So next slide, please. And this is really a comment about the issue I mentioned at the beginning about people not really understanding what support groups are. We thought we had a lot of people responding, probably maybe 2/3 of the respondents said that they belong to a support group, whereas in actual fact that number was only about 1/3, because people were writing down they belong to a support group when in fact their team was being supported by an international NGO, which was providing clinical care. And so it wasn't the kind of support group that we had imagined people would be thinking about when we designed the survey. So I think we should have been a bit more clear about what a support group was. But we had all the same, we had a good range of responses from across the globe. And we were especially keen to hear from people who weren't members of support groups to find out why. Was it because there weren't any? Was it because they weren't particularly interested? Was it because they didn't feel it was important? So, and we had good answers to these questions, which we will be dwelling on when we actually go through our recommendations. So if we have the next slide. We can start moving on to the recommendations, which we'll go through one at a time, and we'll start with the first three recommendations are going to be presented by Diana.
Good morning, everyone. I'm so happy we're having this conference, and I'm so happy all these topics are being in the center of a meeting like this. So I'm Diana Borges. I'm working in Oaxaca, Mexico. And I'm gonna take you through the first three recommendations. We all know we are living an important transition in the way cleft care is delivered. We all know the importance of comprehensive cleft care, and many teams around the world are adjusting their models to be able to offer a comprehensive approach to patients and families' care. We also have all seen the difference in the results of a patient with a family who is empowered and takes a role in the decision-making process of their children. And we also know for countries like South Africa, UK, Malaysia, or Brazil, how important the role of a parent and patient support groups have been in changing for good the reality of children born with clefts. So our first recommendation is to enhance awareness about the unique importance of parent and patient support groups amongst the cleft team. In order to do that, it is important to identify a passionate and driven person who can be part of the team or can be part of the community and is willing to take the first steps in this important action. We can discuss the best ways of reaching the cleft teams with these messages during the roundtable discussions. We have some ideas. We will all be happy to hear your ideas about that. And so our discussions were around like, how can we, what is the best way to get to families or patients? And the usual way and the direct way to get to the patients and families is the cleft teams. So it is very important. This is why this is recommendation one, and it's like how important it is to enhance awareness about the importance and the unique importance of parent and patient support groups to the cleft teams. In our questionnaire, we will see in the next slide that many of the professionals that replied to the questionnaire, they knew the importance of patient support groups, but only a third of the surveys were aware of a patient support group around their communities. So that's why this is recommendation one. And it's also very important to explain the different impact an organized and PSG can have in cleft care. They can like either support other parents, or they can impact in the public policies making in a state or in a community. They can also help or facilitate the work of the cleft teams. And it's also very important, and that was a part of the comments of the last session we had, and it was like, we cannot talk about comprehensive cleft care without including the family. They are part of the team. They should be part of the team, and we all should be aware of this and should be promoting the initiation and sustaining patient and parent support group. Next slide, please. So as I was saying before, why we need this? The 98% of the care providers believe support groups help improve cleft services, but only a third of the surveyed were aware of the system of a recognized support group. So we all sort of know the importance, but when you are immersed in a hospital or in a center, and you're like dealing with patients, with surgical programs, with meetings, conference, students, then you know that is important, but you really don't know how to get started. So it's very, very important that we enhance the awareness about the unique importance of a parent and patient support groups to CLEF teams. Next slide, please. Okay, recommendation 2. It was interesting, as Garrett was saying before, to find how the concept of parent and patient support group was confusing for some of the surveyed parents and patients. That was part our because we maybe were not clear about this concept in the survey, but also because some of these questionnaires were getting to the families through their CLEF teams. So this is what we were discussing in the last session, right? Like if this information or this question is coming, now am I?
Yes, you came back.
Good, I'm sorry. It was one of the observations was that some of the parents were thanking the group or the team. So, and this is because the questionnaire was get to them through the organization or the CLEF team they are being part of. So this was very interesting to see. So families really need to know the impact their work can have if they come together and advocate for their children, offering peer emotional support to new families or patients, facilitating the work of the CLEF team, providing information to patients and families, or pushing the implementation of public policies to improve resources. They, in a low middle income context, it was clear that patients, they don't really know all these possibilities. They don't really know the impact of their work or the impact their work can have. So it is very important that once we have done recommendation 1 and we have that passionate person, then we can start transferring all this information to the families and the patients. And which is really important was also to see that the peer connections of where affected individuals relate emotional and practical support to each other. So it's never going to be the same, the support a professional can offer to a family and a patient than the support a family or a patient can offer to another patient or family. This is so important for them, and we will see the comments they offer later in the slides. Next slide, okay. So it was beautiful to read all the grateful comments families and patients who had the opportunity to be part of a PSG share with all of us. That's the best evidence of need our work will have. We know about the work of Garrett in the UK. We know about the work of the PSG in Brazil. We had a meeting with some of the leaders of parents and patient support groups there, and they started with just inviting people to meet. And the most important thing they suggest is to create spaces where real people can have real connections, right? That was their suggestion. What we need to do is just to get to allow people to connect. Once that is done, then many ideas and many strategies will follow. So we go to recommendation 3. After enhancing awareness between CLEF teams and patients and families, we couldn't resist to make recommendation 3 a step-by-step guide of how to initiate a patient support group. Why? Well, it seems we all know the importance of a parent and patient support group, but how to get started? We really are immersed in patients, surgical activity, consultations, and in the middle of all that, this seems like a gigantic task. But if we have an easy and friendly guide, we are pretty sure most of us will give it a try. That's why this is our recommendation 3. So we have the opportunity to follow different models according to the characteristics of our community, no? Formal, informal, both of them have had great results. When the group was guided by a passionate and a passionate person who can glue everyone together, and so they can achieve the agreed goals, that it was the strategies were different, but the results were impressive, no? So the 88% of our healthcare professionals say that they will like some downloadable guidelines on how to set up a support group. And there have been discussions about what is a safe place for families or patients to meet and provide mutual support. Now we have all these that seem small doubts or simple doubts, but all these are stopping us to get started, right? So the other aspect was, then once you get started, how do you maintain this? No, more than 3/4 of our surveyed connected with a support group said their group received not funding. So that's one of the major challenges. Now, how we keep the work going on, because we need people that is working every day to maintain this. So in our step-by-step guide, we'll include some of the different tools or different strategies we can use to overcome these challenges. Here I'm gonna pass the word to Gareth, which is he's gonna follow with the recommendations.
Okay, thank you, Diana, that's great. The last 2 recommendations, I'll just talk you through now. And I think Diana is right. A lot of people come up with the issue around lack of funding, but things can be done with very little funding. I've worked in all sorts of NGO and voluntary settings where a lot can be achieved by the right connections, but that could be part of the step-by-step guide. So recommendation 4 is, we got onto sustainability now. So we had educate, initiate, and now sustain. And there's 2 ways of sustaining that we've discussed. One is through actions and activities. I think with a good communication with the CLEF team, you can identify what is not happening that could happen with the help of families and patients. It can be through awareness raising in the community, it can be campaigning for better resources. But I think the important thing is for the team and the support group to sit down together and say, what are we lacking? What are we missing? And that's going to be different in every setting, from a high-income country setting to a low middle-income country setting. But I think the commonality will be deciding what the priorities are and actually working together as a team, the families, individuals, and the CLEF team, to actually try and address some of those things. And big things can be achieved by a few voices with the right connections. And the next slide is the recommendation, sorry, evidence of need. So we found that 3/4 of those surveys said, who weren't part of the support group said they would join if they were offered information on practical support around feeding, improved communication. So these, if those areas are lacking in your CLEF team, then you can get a parent support group to help you spread the word about information, set up a bottle, baby bottle service, or things like that. There's all sorts of models. And just raising awareness about nutrition in the community. We heard this from Diana that 85% of patients in Mobile Surgery International are undernourished. So, and a CLEF team member told us, we want to improve our support structures to be able to have better impact in our community. Use the families. They're there. They need to be used. They want to be used. They're highly motivated. They might need some harnessing and steering, but they're highly motivated and they come free of charge. So the final recommendation is sustainability through peer support and continued research via online resource and communication hub. This is probably the most ambitious recommendation, but it would be wonderful if we were able to have a centralized repository of guidance and toolkits in different languages. It could be a global patient voice for CLEF care, representing, advocating for parents of international bodies such as WHO. And I think it would be a permanent online resource for support groups to draw on and CLEF teams to draw on and download information. And giving our survey, next slide, please. Giving our survey, we know that 98% of healthcare professionals felt support groups can improve the lives of children. And the wonderful thing is also that all the patient group representatives we contacted want to carry on connecting with each other and supporting each other. And there was a great interest in being used for further research. So there's a very high number of people there who want to continue to communicate and continue to support each other on a global level. So I'm just looking at the time, and I think we're more or less at the end of the presentation. So I think I've got the timing about right within 1 minute, I think. So
sorry, Gareth.
Yeah.
It's just 2 more minutes till the round table, so
Okay.
so we're good.
That's fine. That's fine. So the recommendations simply are, I think, almost like the first group. We need to educate. First bit is education. Why are these things important? Educate the CLEF teams, who are the obvious conduits of the families, and then educate through the CLEF teams the actual families themselves and the patients, so they're aware of what is really important and what role they can actually perform in terms of improving overall outcomes. And then the next step really is to really provide a tool for helping everyone initiate and get those support groups off the ground. And they may well have different shapes and different forms in different contexts. It could be very easy to set up a localized Facebook group, but is it safe? Is it monitored? Those are the things you have to bear in mind. You could have a formally structured registered committee, but that's hard work, maybe for just 1 or 2 people. So you need to balance these things out. And I think the CLEF team does have a role. I know there's not enough time for many things, but there needs to be some kind of accountability for any sort of support group. So we need to build that into how to initiate and manage. And then the final steps are actually really drilling down and finding out what the needs are of the CLEF team and the families, and seeing how they can all work together. It's been said before that the families are part of the CLEF team, the children are part of the CLEF team, and they need to work together to address those gaps and actually find what can be achieved together at a local level, national level. And then the final one is, how can we actually support all of that internationally with some kind of resource hub? Very ambitious. But in our discussions, we were actually thinking about the roles that international NGOs might have in terms of, well, we won't give money to this particular CLEF team unless they have a proactive way of developing a support group. So there can be types of levers and things brought in to actually encourage this process. And it would be wonderful to have some sort of international advocacy service that we could have and present campaigns to World Health Organization, UN, etc. So I think we're there now, and I'd be very happy to hear everyone else's views. And I'm going to ask two key members of our group to actually co-chair the next session at the roundtable, which is going to be Zainal and Felicity. So I'll hand over to them. Thank you.
So thank you very much, Gareth and Diana, for excellent presentations summarizing really important work. And it's been a pleasure working with this solutions group. Also, thank you to Alexis and Christian for keeping us on track and being so efficient. It's a huge pleasure to introduce Zainal Ahmed as the chair of this session. He is the father of a son with a cleft, and for 18 years has been the chair of CLAPA Malaysia, and with his wife has also written a book in Malaysian, but it's a fantastic book. So I'm going to hand over to Zainal.
Thank you, Felicity, Gareth, Diana, and Alexis. I see Fernando has got his hand raised, but before that, we'll follow the same format that we went through in SG1. If you have questions, please raise your hand. And if you have a comment that you like to put in the chat, please put a C before what you write so that we know it's a comment. And if you have a question, if you could, please put a Q so that we can catch that as a question that needs to be addressed. So for now, we'll let Fernando in. Fernando?
Yes, thank you very much. This session has been very, very informative. I'd like to know the opinion of the group. Are support groups, parent support groups, ideally have to be associated with, let's say, a CLEF center or an established organization, or can they exist on their own? Let's say if as a social group where parents just come together and group themselves as parents of children with cleft. Is it necessary that these groups have to be attached to an established institution or organization?
Okay, we'll open the floor to whoever would like to share their experience. Anyone? Okay, we have Kim.
Sorry, I can't seem to find my hands up button. So in South Africa, we have the Smile Foundation, which is a nonprofit that does surgery on children or facilitates the surgery on children with cleft lip and palate. And we have what we call a project of Smile, which is the parent support group. And that we work hand in hand with the parent support group. So we're starting from the very beginning at educating the maternity nurses that when a baby is born, we send a parent from the parent support group and one of our coordinators from the NPO to actually walk hand in hand with the parent and the child so that they can educate them on what they need from the very beginning before the surgery and the recommendations even start. So the parent doesn't feel afraid and is actually comforted by having someone who's been through the process. We then work in 17 different government hospitals in South Africa. And all of those, they then reach out to the cleft group or to Smile Foundation if they need help or support with the patients. So that's how we do it in South Africa.
Thank you.
Okay, we have Panon 1 from Thailand.
Yes, thank you. I'm from Thailand, from the north of Thailand, border to Myanmar and Laos. To respond to Fernando in Thailand, they separately set up by their own, but they also need our help to facilitate. We set up a kind of in Thailand. We use Line, 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 instead of WhatsApp, and then we set up the Line group, among the parents, and then they can share their experience. And why, in Laos and in Thailand they use Line group, but for Myanmar they use Facebook, so it depends on the particular country. And before COVID, we also, when we are traveling, visited the family in the community, we also invite some of the I heard someone talking about role model, invite some of the key parents who have a special experience, traveling with us, and then it's very work, for this mother, to share experience, in person to others in the community. Thank you.
Okay, Daisy.
So I want to share a little bit my experience here in Nicaragua. What we have in my center is that we try to make some informal, let's say for now, solution groups for parents. And what we do is that we invite our parents with cleft lip and palate patients, the one that receive already treatment in our center. And we also participate, professionals participate, like talking about the pre-surgical appliance, talking about how to brush their teeth, talking about all the process that the children will go through. But the most important is to invite those parents that we know they already have like experience, for example, that they already passed this stage, and to observe which of these parents are the passionate, motivated one. And when what I want to say that even that some professionals started these groups, when you invite these parents and you observe the ones that are leaders and they start to share their experience, the other parents, the new parents with the newborn babies, they feel not afraid to share, to ask. And there's when you really understand what are the fears they have, what are the questions they have, because when they hear these parents, they open to talk about. So what I want to encourage is that it's okay if right now some people or some centers don't have this group still, they can start with the professionals inside their centers. And as soon as they begin to invite parents and invite children, when they begin to grow, you'll see how this will flow. So this is my opinion.
Okay, thank you. Julieta.
Hola, buen día. Bueno, quisiera compartir la experiencia de Bolivia, de la Fundación Aininacuna. Y para nosotros es importante contar con una guía metodológica, con una guía de trabajo para el abordaje de grupos de apoyo y tener claro el objetivo y sobre todo cerrar ciclos, ¿no? Empezamos con un grupo de padres que está viviendo por un periodo traumático de impacto como cualquier familia que ha nacido con un niño con fisura, pero si cerramos esos ciclos, entramos en un proceso de los papás que ya se convierten en un comité, por ejemplo, un comité que ya puede hacer exigencia al Estado en temas de políticas públicas, ya de respuesta, por ejemplo, al tema de las fisuras en Bolivia en este caso. Entonces, esos ciclos son importantes poderlos evaluar y ver que hay procesos, ¿no? Hay procesos que hay que trabajar al inicio, a mediano y fortalecer ya otras áreas en las familias. Nos ha enseñado eso la experiencia a nosotros, contar siempre con unas guías y respetar los ciclos y los tiempos de cada grupo, que no son más de 15 en este caso, nuestra experiencia. Gracias.
Okay, thank you. I hope those who do not speak Spanish manage to hit the translate button. Then you can hear the explanation in English. We have one more here, Zainab. Sainem, sorry if I mispronounce your name.
Sorry, it's okay. So I was thinking about something that Julieta said about like it's a traumatic experience, like especially in the initial phases. So like that brings me to think about actually trauma-informed care in terms of like us, because everyone can do trauma first aid. Like if you're looking at it from a psychotherapy perspective, everyone can do psychological first aid. So I was wondering if like it would be possible to train the parents, like find some parents that, you know, have worked through their own emotions, have been through their own process, and, you know, take them in order to provide the psychological first aid to the parents who just had kids. So with that, I think there was an example that was given. I forgot the name of the person, I apologize, but like recruiting parents and then like have them go into hospitals and recruiting other parents for the support groups, I think might be very helpful, and it would be a first step. And then I think we are again in this phase where we need funding and advocacy for this work that we're planning to do. You know, like where we need buy-ins from the administrative staff, we need buy-ins from the hospitals, from NGOs, so that we can have funding for this kind of work.
And I just can't keep track of all the comments and the questions. What I would do is encourage all of you to take a look at the chat. Meanwhile, we have 3 more raised hands from Rocchio, Diana, and Gareth. So, Rocchio.
Thank you for this meeting. It's very important to share all our experience, and well, I will want to share my experience in Creciendo. And my group is working in Peru inside a university, and we are right now we're having about 300 kids with cleft. And since the beginning of this work, we find that we need a group of parents to they need to share their experience in cleft. And with this group, we found a lot of learning from them, and we use also this it's just a WhatsApp we use for this group of parents and patients, and it helped us to know what are the needs they have, and we use this group also to teach them a lot of things we found they need since also the beginning of the experience of having children or a kid with cleft. So I found sharing this group, having this group to share with them was very useful. So I think it's very important to have this kind of we need a guide to share, put a new, for example, a new parent. We need to guide him how to work or how to share with all the group, because at the beginning, all the parents get in and make so much I don't know, so much they put a lot of information that we don't have to, we don't want to have that kind of information. So we have to teach them how to what to put in that chat, no? And they finally found what to put and what not to put in that chat. So it was very useful, even during the pandemic that in Peru was very long, no? And so we used that. It was very useful to know what they need and what are their problems, no? And help the parents each other to know how to share with the other parents, no? Well, that's what I want to share with all the group. Thank you.
Okay. Thank you, Rokio. We have Diana, Gareth, and Daisy again. Before that, let me try to address Fernando's original question, which is to do, should the PSG be structured? Just like to share the model that we have adopted in Malaysia. It was started.
Zainal has frozen there. Oh, you're back, Zainal, fine.
Sorry, yeah.
Zainal, I was just going to say, I'll keep an eye on the chat if you like, and I'll only step in if you freeze.
Okay. Thank you, Felicity. Our experience is, the organization has to be structured. Without the structure, then there is no credibility with the healthcare providers. Where we are today and why we have lasted 30 years in Malaysia is because of that element on credibility and the element of the healthcare providers finding us as a help as opposed to someone who is causing them problems. We are not affiliated to any hospitals or cleft centers per se, because we work independently and we support all of the cleft centers throughout Malaysia. Does that? We are the only national-wide organization that provides cleft care in Malaysia from a parent support perspective. And our services are from antenatal all the way to helping the adult cleft be confident in their life, getting on with their career, having a family, basically becoming a contributor to society and being proud of themselves, regardless of their condition and the completeness of their cleft protocol. So that's our model, that's our view. Can it be replicated elsewhere? I don't know. But if there are any out there who would like to know more about us, we will be more than happy to share what we have done so far. Okay, now.
Thank you, Zainal.
Okay.
Zainal's frozen. I might just make a comment. I loved that Fernando got straight to the really heart of the practicalities, and it was something we discussed in our group, wasn't it, Zainal? Whether it should be low barrier to entry, informal WhatsApp, not linked with the cleft team versus something more formal. And I don't think there is a one size fits all, but I think the accountability and the point made earlier about the potential for parent stories to do good versus harm, having maybe a more accountable structure and governance for funding is important, but we recognize that's a lot more hard work. So how do we make that hard work easier?
Right. Diana?
Hey, thank you. I just wanted thank you for all your comments, and I'm going to point out some questions I have, and I would like you to reply in the chat so we can all have that information. The first is regarding Eduardo's questions. Before coming to Mexico, I was working in Barcelona, and there are different centers there. And I had the chance to see how the parent and patient support group was growing. And it was very important that they were an independent organization. They had patients from all the centers, and if they were linked to a specific center, that will limit the number of members of the group. So I think that's very important. I wanted to decir gracias a Julieta por su aporte, por contarnos su experiencia. Me encantaría saber más sobre cómo han abordado las diferentes obstáculos que puede presentar las diferencias culturales que tienen en una comunidad más rural, ¿no? Eso me encantaría hablarlo contigo, Julieta. Muchas gracias. And part of our discussions were, as Felicity was saying, how challenging this is, because it's a new task to do. So one more thing in our to-do list. And we were wondering, and I had this conversation with Gareth sometimes too, and how can we have support from the NGOs? Like we work with a Smile Train, like, is it possible that maybe we can meet all and agree that maybe we can have a grant for that? Because then we can hire a psychology to run this group, like to get started, and a social worker, for example, because working in a context like Oaxaca, this seemed like a giant task. Support is needed. So I want to know the opinions of people from leaders from different NGOs about this. Thank you.
We have Gareth and Daisy is waving her hand frantically. So let
Yes, thank you. Well, yes, because it's something about what Diana have already said. So I wanted to continue and say that we really, even the support groups need support groups. We need also to be supported. So in what she mentioned about Smile Train and some organizations that work with some centers, I think it's very important. In my case, we are Smile Train membership. So, and I wanted to say thank you to Smile Train too, because right now some support that we receive from them is some educational resources that are very important for our groups. For example, the Mathy dolls provide us the continue teaching and educating parents with children with cleft lip and palate. Other things that we can ask as Smile Trains or other groups that we work with is all the educational materials. I think that brochures, books, or painting books with cleft lip and in some information. It's very important. So I wanted to point on what Diana said, and I agree with her too, saying that we also need to be supported. So let's go to our main centers, our main members, and tell them that we are working and that we will appreciate their help too. So that's a point I wanted to say.
I agree with Daisy in terms of the support groups need support. Otherwise, the group would die off, or the group will no longer become effective. Gareth, you had your hand raised and it's lowered. You want to say something, Gareth?
Yes, I'll keep it brief. I'll get a chance to say something a little at the end as well. But I do think that what's being raised just now is key. We don't just need to educate the cleft teams. We need to educate the NGOs who fund those cleft teams that it's a priority, and that actually investing in a support group, whether it's time and or money, will actually provide in the long run a resource for that team to thrive. And I think that's the message really we need to get across, and likewise to anyone who's supporting cleft care, that they need to realize that so much more can be achieved if support group is encouraged to develop. And in answer to the very first question about can these groups develop on their own and work independently, the answer is yes, but I think so much more can be achieved if they work together.
Right. Monica?
Yes. Thank you, Sonia. I just wanted to comment as well on this as part of the Smeltering family, because I know that we have been working tirelessly on making sure that the treatment that we offer is patient-centered. And for sure, many of the things that are around that, we keep learning on different contexts, we keep learning on different challenges each group is having. So, and I was just commenting aside with Daisy, because we've been working about oral health programs and how to make sure that this goes into the families, and just making sure that the parents and caregivers know, understand, and realize that they are the most valuable players in this whole treatment. So empowering them with the resources, empowering them with knowledge, and also with the tools for them to support the rest of the community, I think is truly important. And for sure, Smeltering has been doing some specific pilots here and there, identifying and supporting ideas on how these support groups and psychosocial efforts and things such as the singing clubs, or things that where parents can be part of this, important part of this, and they feel with the backup of an organization that is just giving them the spotlight to be sharing their story, to be also making sure that being at a hospital or a clinic, it doesn't become something formal, but it's more like creating a community that they are part of. So yes, for sure, I think that it's important that we keep raising all these comments, that we come and keep the discussions, because I am pretty sure that something really great can come up from this. Thank you.
Thank you, Monica. What I can say is, I can see a lot of energy. I can see a lot of passion in this particular topic. And, I, for one, would like to thank Felicity and ICC that recently concluded in Edinburgh, because that was one of those ICC where the peer and parent support group were given an airtime to talk about PSG and what we do and how we contribute to the comprehensive cleft care. And the thing that came to mind is this bit about the unique approach or the unique contribution that PSG can provide, because it's a lived experience that the doctors and others may not have. But the parent live with the child 24 hours, 365 days a year. Oops, my connection is not that good. But I hope all of you enjoyed this roundtable. Alexis, are we almost up?
I think Garrett would want to wrap up and leave us with the last thoughts before our break.
Okay, Gareth, it's all yours. Felicity, thank you for helping out.
So how much longer have we got? Because I actually had a question, but when have we, and because there was a session for wrapping up that I think comes.
We should be done in 10 minutes. So
okay. Well, first I'll make a brief question point I wanted to make, and it's about anyone who thinks that there may be some risk involved in involving families, and that has happened in the past. Health professionals will think, is it safe to trust a family who's gone through a bad experience to supporting other family? That can be overcome. We offer training. It came from Clapper originally. We've used it in different countries where, like Sengam said, we'll identify the right parents and we'll train them. We'll base listening skills and issues around cleft care that are most pertinent to actually be a proper support befriender to a new family. So, and that I think puts minds at rest. I remember my early days at Clapper. In order to buy in support from health professionals, we had to actually provide a service that showed the health professionals that we were responsible and accountable. So I think that's part of it as well. It's a two-sided thing. But yeah, so that was my final point. And I think Diana was going to actually pull out some things that will point towards a wrap up. I don't know whether she's got some things to say right now. If not, I can wrap up myself. But Diana, have you got some things you wanted to pull out from the discussion?
Thank you, Gareth. Well, this was an amazing roundtable. Thank you, everyone, for sharing and asking and pointing out all these different points of view. We have a reflection of the conversations we had in our solutions group. We all think patient and parent support groups are of paramount importance. We all think they should be an essential part of the CLEF team. I do think that, and there were questions about how we can do that in LMICs, for example, which I think is, I don't like to say education, but like transferring information so they can know all the power they can have and all the impact they can have in getting together and organize and help or changing their children's quality of life. And there were also a lot of comments about which professionals should be part of it. And also how do we conduct this? And so we are all going to summarize, as Felicity said in the chat, all these comments. And then there are next steps after this, because as Michael Nebecker commented before, is like, yeah, we now have all this information, but what happens next? So we have a meeting in a week to continue with all this work. So thank you, all of you. We are going to start working with this step-by-step guide, so we all know how to start and how to follow and how to get support. I'm sure out of these meetings and with the NGOs are gonna happen, and we are gonna start working on it, and we are gonna get support to have all this work done. So thank you, everyone. Yes, thank you for being here, and thank you for understanding and like putting this topic in the priority list of our comprehensive CLEF care.
Great. I just like to thank Diana for that, and I really got nothing to add apart from saying this has been a very exciting group to work with, and all of you have contributed a lot within SG2. And I think the volume of responses to our surveys we sent out indicates this is an area that's very much alive and wanted. So I think we can't let it lie low. We need to keep pushing. Thank you.
Thank you. I was actually with my first SG group that I ever been a part of, and I learned a lot, and it was a great group. And I really hope, like it was mentioned earlier, that it's not just like, okay, what we learned, but what do we do with this, and that there'll be some applications for each of your centers. So thank you for being engaged. Thanks for all the team members and the support team that help us through this process. I just want to remind you that we have our last session of the day coming up. It's integrating psychosocial care across CLEF specialties, but then before that we have a break. So we will start in about 10 minutes. So you're welcome to head to the coffee room, and we'll meet in SG3 in about 10 minutes.